The Disability Rights Fund and the Disability Rights Advocacy Fund are together the largest funder of organizations of women with disabilities around the globe. We fund with an intersectional and gender lens, and our grants focus on broadening and diversifying the disability movements in Africa, Asia, Pacific, and the Caribbean. Approximately 15% of all DRF, DRAF giving goes to organizations of women with disabilities. And the top priorities our grantees address are violence, access to justice, sexual reproductive health rights, and access to education. Today, you will hear about what women and girls with disabilities worldwide are experiencing during the pandemic and how they are addressing abuses and fighting back. Indigenous women and girls with disabilities who, isolated inside their homes, are at a higher risk of abuse from a family member. We know the reality, but we are not able to bring those voices because those have been suppressed due to the issue of social protection, the lockdown. What is going to happen? If I am raped and I tell about my father who raped me, what will happen after tomorrow? Who's going to look after me?
HWDI, Indonesia's national organization of women with disabilities, conducted a survey and focus groups about gender-based violence during the pandemic. Here's what they learned.
Those who experienced sexual violence reported that 70% was in the form of sexual harassments, 15% rape, and then 10% sexual exploitations. The third is 68% of respondents did not report their cases to the police due to the stigma and lack of support. And most of GBV or gender-based violence victims assisted by women providing legal support are girls with intellectual disabilities. And the perpetrator is usually someone close to them.
Since COVID-19, the Deaf Association, with the help of sign language interpreters, provided sign language interpretation for health information on the Samoa Ministry of Health, Health of the Nation program, and states of emergency addresses. This gave our members access to much needed information, and it is the first time that national communication has been translated into sign language during an emergency.
There's a fear to report, knowing you are locked in this community with the perpetrators.
The challenges that we have been facing as girls, we have no access to sexual reproductive health services because doctors had more attention to COVID-19 patients. Family planning had stopped in health centers due to lack of money due to COVID-19 expenditures. Minibus transport has gone up due to limited capacity. As for me to go to the hospital, I need to pay double as I need an assistant.
Women with disabilities are usually the most targeted by violence perpetrators who take advantage of persisting barriers in communication, attitude, and of course, justice system. COVID-19 multiplied the risk of discrimination and violence for women with disabilities because networking opportunities were reduced as they were not able to join their safe spaces. COVID-19 had differently affected their livelihood, their social, their emotional life. Also, we initiated a new working relationship with local authorities to ensure where we are not able to meet, to appropriately support girls and women with disabilities, at least they can be supported by the local structures. I can say that COVID-19 also increased the opportunities for partnership and advocacy for inclusion of women with disabilities in the COVID-19 recovery plan.
These stories show the resilience of the disability rights movement amid an ongoing pandemic. The Disability Rights Fund and the Disability Rights Advocacy Fund would like to thank you for your support.